And we're back with part 2 of lab number 1, Hi Bio 47. Right now I'm going over anatomical terminology, and this starts on page 3 of your lab manual and continues until about page 5, 6, and 7. So the first thing to see here is that this individual is in the standard anatomic position. Standard anatomic position means that an individual is standing upright, has the upper limbs, also known as the arms, at the sides, has the feet together with toes pointing forward. And you can see that the face is directed forward, the feet are forward, and the palms are forward. This means that when you're in standard anatomic position, the palms are always facing forward and the thumbs are always out to the sides. The thumbs are always the most lateral, away from the midline. It's important to be able to describe somebody based on standard anatomic position because it's important to have an anatomical reference point from which all direction and organization can be compared. So when we're describing an individual, no matter how their body's actually arranged, we'll be describing them based on as if they were in standard anatomic position. Other things that we'll be looking at are the anatomical terms that are used to describe different areas of the body. And this is all based on surface anatomy. It's all based on what can be seen from the surface. So I'll talk through some of these terms that will be important to know. So if we go down here, we're looking now at an anterior view of this individual. So we're seeing the front side, and we'll be looking at the terms that are used to describe the anterior portion of the body. The first one refers to everything in the head. The whole head is the cephalic region. The front, the back, the sides, all of that is the cephalic region. The part that makes up the top of the brain case, this is called the cranial region. The nose is referred to as the nasal region, and the neck is the cervical region. The eye is the ocular region. The cheek is the buccal region, and the mouth is the oral region. If I keep going down the left here, we're in the armpit region. That's the axillary region. The armpit region does get its own name. It's going to be an important site for some blood vessels. The brachial region is this region where you probably recognize the biceps brachii. So it's that upper part of the arm. And then moving down into the forearm, this is called the antebrachial region. Ante means before, so it's before the brachial region. If I continue to move distally down the arm, I get to the wrist, which is referred to the carpal region. If you've heard of somebody talk about carpal tunnel syndrome, they're talking about something in the wrist. The whole region of the hand is the manual region. The palmar region is the palm of the hand, and the fingers are the digital region. So the palmar region, together with the digital region, make up the manual region. The thigh, this upper part of the lower limb, the leg, that's the femoral region, named for the femur bone that it contains. The anterior part of the knee, where the kneecap is the patellar region. The anterior part of the lower leg, or the lower part of the lower limb, is the crural region. This is an area that you might refer to as the shin. We'll call it the crural region. The foot is the pedal region, and it contains the second digital region. Remember, we had a digital region up here at the fingers, and another one down here at the toes. Just like the wrist got its own name, the carpal, the ankle gets its own name, and that's the tarsal region. So there are a few on here that I haven't covered. Let's see, the whole chest region. Remember, we had the thoracic cavity that contained the lungs, the heart, and the mediastinum. That's the thoracic region. The region of the breast or of the pectoralis, that's the mammary region. moving downward, the area that contains that abdominal cavity, that's the abdominal region when viewed from the surface. The belly button region, that's the umbilical region. And we got to pick up one more on the arm. Inside of the elbow, this is the antecubital region. This is a common site for blood draws, for instance, in the antecubital region. Then if we keep moving down, we get into the pelvic region. And the pelvic refers to this whole area right here, below the abdominal region, but above the femoral region. And it's divided up into a few sections. So the hip area is called the coxal region. The inguinal region leads down into the pubic region. And now if we look at the dorsal side of the patient, you can see a few more body regions that we have yet to name. So the point of the shoulder is the acromial region. So we get the acromial region, which is named for a bony feature of the scapula, that shoulder blade bone. So acromial region, the point of the shoulder. The posterior of the elbow is the olecranon region. That's where you can feel your funny bone back here, which is the olecranon of the ulna. Remember that the other side is called the antecubital region. We can still see the coxal region, that hip bone. And we get a new region here, which is the lumbar region, and that's the lower back. Remember, sometimes if you buy chairs or you're looking at pillows, they say they provide great lumbar support. That's this region right here, where you have the lumbar curvature of the spine. The gluteal region is marked by these prominent gluteal muscles. Then we're looking at the posterior femoral region right now. It doesn't get a special name. If we're at the posterior knee, remember the anterior side is called the patellar region. This is called the popliteal region, and it's going to have some blood vessels traveling through it as well. So the popliteal region is this indentation that has blood vessels and other structures traveling through it. On the anterior side, the patellar region is marked by the patella, that kneecap bone. If we keep moving inferiorly, then I get to the sural region. The sural region is what you might commonly call the calf. This is something that's a little bit tricky to think about because the sural region corresponds to the calf. The crural region corresponds to the shin. So you have C and S together, but they're mixed up. So sural, calf, crural, shin. And then last, we get into the heel of the foot where the calcaneus bone is. This is the calcaneal region. And that would be part of that pedal region, part of the foot region, together with the digital region that makes up the toes. To practice with naming these structures of surface anatomy, what I would do if I were you is draw out a person on a sheet of paper, front and back. It doesn't have to be good art at all. I'm not an artist, but I am capable of doing this, so I think you should try it out too. So draw a person. It could even be a stick figure, but make sure that they're in standard anatomical position, and then try to label as many of the regions as you can. And that's a good way to just start practicing, starting writing these words, starting getting them into your head, and practicing with them. Some other standard language of anatomy includes directional terminology or relative terminology. So describing where on the body a part is in relation to something else. So right now we're looking at the patient from a side view, and some of the directional terms to start understanding would be superior and inferior. And this is used to refer to structures that are on the trunk. So superior means toward the head, inferior means toward the feet. Sometimes the terms cranial and caudal, meaning toward the head and toward the tail, are used. This is less common in humans because we don't have much of a tail. So you might say that the cranial region is superior to the cervical region, which in common language would be the head is above the neck. If something is toward the front of the body, it's said to be anterior or ventral. If something is toward the back of the body, it's said to be posterior or dorsal. So you could say that the nose, the nasal region, is anterior to the buccal region, the cheek region. You would never just say the nasal region is anterior. It's always relative terminology, so you have to say what it is anterior to. Let me make sure I got all the other ones on here. So we got superior and inferior, anterior and posterior. Others to know would be superficial and deep. So superficial means toward the surface of something. So your epidermis is superficial to the muscles that lie underneath it. The muscles are deep to the epidermis. Somebody is said to be supine if they are lying on their back. And they're said to be prone if they're lying on their stomach. So we'll see some cadavers in lab that are supine. That allows us to look at their anterior aspect, to look at their abdominal organs. We'll see some cadavers that are prone, that are lying face down, and that lets us get a look at the posterior musculature. Supine and prone apply in one additional way, and that's to the position of the forearms. So not only can a body be supine or prone, but your forearms can be supine or prone as well. So if you have your arms out like you do in standard anatomical position, like our model does here, with palms facing out as though you could hold a bowl of soup, then they are supinated. If palms are facing down or toward the back, away from standard anatomical position, then they're pronated. And we'll learn about the muscles that are responsible for supination and pronation of the forearm, that unique rotation of the radius and the ulna past each other. Other terms to know would be medial and lateral. So medial means toward the midline, and the midline would be this line right here that divides the body into left and right halves. Something that's farther away from the midline is said to be lateral. So the coxal region, the hip, is lateral to the umbilical region or the belly button. For comparisons within a limb, within the arm, or within the leg, we don't use superior, inferior, even though it looks like it's above and below. Instead, we're going to use the terms proximal, meaning closer to the point of attachment, or distal, farther away from the point of attachment. So the antecubital region would be proximal relative to the carpal region. The digital region would be distal relative to the antebrachial region. Down here in the leg, let's see, we have the patellar region. The patellar region would be proximal compared to the, what's that region of the shin again? That's the crural region. And we already talked about superficial, meaning closer to the surface, and deep, farther away from the surface. So the skin would be superficial to the muscle. The muscle would be superficial to the bone that it overlies. The bone would be deep to the skin. And we talked about supine and prone, how they can be both a hand position and a body position. One last thing would be planes of section. The human body can be dismantled or dissected, or you can simply visualize using, for instance, visualization technology to divide the body up into these imaginary planes. These are flat surfaces that could pass through the body. So the first one I'll talk about is what's illustrated in blue here, and this is a sagittal plane. Sagittal refers to Roman like an arrow, or Latin like an arrow. Imagine being struck by an arrow. If it were a very long arrow, it'd divide the body into left and right halves. So a sagittal section separates left from right. A mid-sagittal section is the one that goes exactly down the midline of the body. So divides the body into exactly equal left and right halves. Sagittal sections, which we'll see on some of the cadavers in lab, will let us look at, for instance, a cross-section of the female reproductive system. Would allow you to look at the middle section of the brain. The next one is the coronal section, or the frontal section, and that's illustrated in purple here on the patient. And the coronal section would separate the front from the back, would separate anterior from posterior, or from front from back. And this would be good for getting, for instance, an internal look at the kidneys. If you wanted to slice all the way down through the kidneys, you'd be using a coronal or a frontal section. And then the last one is the green one here, that's separating top from bottom. This is commonly called a transverse section, or it's sometimes called a horizontal or a cross-sectional section. And these divide the body or the organ into superior, that's the top, and inferior, that's the bottom sections. And this might be good if you wanted to get a look cross-section, for instance, through the thoracic cavity, and get a look at that pleural cavity, the mediastinum, and that second pleural cavity containing the left lung. A transverse section would also be how you would remove the skull cap from the top of the cranium. A transverse section might also be how you would amputate a lower limb.